patient has a nice even gait with easy movement and good posture. Handshake was firm and eye contact was established. I introduced myself to the patient, told him I would be assessing his cardiovascular system, and checked his armband for identification. The patient hears and understands me when I speak English. He has no issues with vision, can sit, stand, and rise with ease. He is on top of it today, interested and involved in his care, dressed in his best, sitting up straight, ready to go. He is alert and oriented to time, person, and place, shows no signs of shortness of breath, and appears to be of healthy weight. For his history, I will ask his name, date of birth, occupation, gender, and about his marital status. I will assess his chief complaint using an acronym called OLD CARTS. I will ask him about his present health conditions, prescribed medications, and allergies. I'll ask about any recent surgeries, hospitalizations, accidents, immunizations, last exam, childhood illnesses, and about any obstetric history. I'll ask him about his family history, personal status, family and social relationships, and about his diet. I will ask him about his functional ability, mental health, illicit drug use, if he smokes, health promotion, and about his environment. I will then assess his general symptoms along with integumentary, head and neck, breast, respiratory, chest, cardiovascular, GI, GU, reproductive, musculoskeletal, and neural systems. I have all my proper equipment. For vitals, I will get the patient's temperature, pulse, respirations, blood pressure, height, weight, BMI, pain, pulse ox, and visual acuity. I will then prep the patient by giving him a gown, asking if he needs to go to the bathroom, and obtaining any cultures. I will then start the assessment, inspecting his general appearance, skin color, and breathing effort. I will palpate his temporal pulses and carotid pulses one at a time, checking for amplitude. I will inspect for jugular vein pulsations at a 45-degree angle, with his chin elevated and his neck turned to the opposite side. I will then inspect and palpate upper extremities for symmetry and skin turgor. I will then palpate the upper extremity pulses, including the brachial and radial pulses, for rate, rhythm, amplitude, and contour. I'll then palpate the apical pulse, which is at like the 4th or 5th intercostal space, and then at the left midclavicular line. I will auscultate his carotid arteries for bruits with the bell of my stethoscope, both sides, and having the patient hold their breath, and then holding their breath again. And then lastly, I will palpate the epitrochlear lymph nodes with the patient's arm at a 90-degree angle, checking for size, consistency, temperature, tenderness, mobility, and borders.